The gaps in our healthcare system are everywhere. We have financial gaps, we have gaps, rural geographic gaps, and one of those big glaring gaps used to be the eastern part of North Carolina. My dad had told me that gap had been closed by Black doctors and dentists. I didn't understand at the time, and this is a puzzle I struggled to put together for years, and this is a story that we tell now. Hi, I'm Dr. Kimberly Singletary, and this is the first of 6 parts of the relatively unknown story of Black doctors' fight for ECU and the fight for healthcare in North Carolina. For decades, advanced medical care in North Carolina was concentrated in the West. Major medical centers consolidated in cities like Durham, Chapel Hill, Winston-Salem, and Charlotte provided the bulk of complex advanced medical care needed in the state, leaving the rural East with limited access to specialties, emergency care, and life-saving treatments. Without a local pipeline of trained physicians, Eastern North Carolina faced a growing healthcare crisis, one where rural hospitals struggled to stay open and patients had to travel hours to see a doctor for complex medical conditions. Without ECU, Brody School of Medicine, that reality would have remained, but its existence was never guaranteed. The fight to establish a medical school in Eastern North Carolina was met with resistance, political battles, systemic barriers, and powerful institutions that sought to keep healthcare centralized in the West. Yet Black doctors and dentists and community leaders knew that without Brody, the region's healthcare system remained fragile and underserved communities would suffer. This is the first part of the untold story of how ECU, Brody School of Medicine, came to be, thanks to the relentless advocacy of those who refused to accept healthcare as a privilege of geography. Stay with us for the 6-part journey into the past, the struggle and the triumph. Understand that it isn't just history. It's the reason Eastern North Carolina has the healthcare system it does today, and it almost didn't happen. Part 1 begins now.